Well, for all of our advances in medical science, there are still so many questions about what actually causes disease, how to prevent it, how to cure it. But what doctors have found over and over and over again is your part in all this as a patient is really crucial. Your attitude, how you approach what's going on with your own body may have more to do with your getting better than anything the doctors can do. Dr. Manon Bolliger joins us here this morning, who's actually, you wrote the book, and we'll talk about your life for a second here, but it's things that you have to ask your doctor. Tell me the exact title of the book.
It's what patients don't say if doctors don't ask. And it's really about the mindful patient-doctor relationship.
Okay, so that's the whole point of what we're talking about here is that relationship. Your personal story, though, as a doctor, you've had two major diseases.
Correct.
Multiple sclerosis and stage 4 cancer.
That's right.
In your life. Did you go to another doctor to be treated, or physician heal thyself, or tell me how you approached it?
What I did, basically, I did get a diagnosis, and so that I knew what I had. And that was a terrifying experience. And so I speak to that in my book because, in a sense, a diagnosis is like a story. It tells you what you've got, but it doesn't tell you why you got there, what you can do about it. And so when I was told, oh my God, you've got 3 kids, you've got to get your uterus out, there's no way that we'll let you go without doing this, I was like, no, wait a minute here. I want to understand why I got here, because something in my life, my stress, the way I was looking at my life, was causing me to get these symptoms in the first place. And
you
so
say we're all really afraid of symptoms.
Yes,
is one of the points that
absolutely.
you make. And symptoms are really nothing more than what?
They're friends. They're telling you, hey, wake up, something's up, listen to your body. It's trying to say something. So we need to work with our body, not sort of suppress it. And if you look at things like, we don't know that much about disease. They say many diseases are incurable. Is that true? Take hypertension, right? Hypertension, 95% of cases of hypertension, they say, are idiopathic, which means that they don't know the cause. Well, if that's the case, when I ask
how do we know it's incurable?
Yeah, well, exactly. And we give pills with calcium channel blockers, and all types of hypertensives, beta blockers, even drain the kidneys. But if you ask patients, why do you think you have hypertension? They know. They actually know.
So that's a question that doctors should ask.
Absolutely. What's going on in the context of your life? What could you change? What agency do you have in your life? What things can you actually do or take responsibility for to make that difference? And when you look at like obesity, for example, the Lancet said 85% of cases of obesity have hypertension. So we say, oh well, do we know what hypertension is caused by? Yes or no? Well, if obesity is so significant, we should look at obesity. So I look up, okay, obesity, what causes obesity? Obesity is multifactorial.
And this you make this point about all kinds of diseases, that they're multifactorial. There's not this real simple answer, and not always just a simple pill or medication or treatment to take.
Exactly.
To deal with that.
Yeah, because taking just a biological or physiological approach is based on test tubes, right? We don't live in a test tube. We live in reality, in life.
People want simple answers, though, and I think that's part of it.
And that's why we are also responsible for our health. And it's not just go to the doctor, get a pill. So I'm not blaming doctors and saying, oh, you shouldn't be giving pills. We're the consumers. We're asking for these pills. And the thing is, they're making us sicker and sicker and sicker. And I think the statistics is 155 million Americans have multiple chronic diseases. That's massive.
And you would think, and I think this is the question that a lot of people ask, with all the money being spent on research, with all the medications, with all these advancements, shouldn't we be getting markedly healthier?
Well, exactly.
And it really doesn't appear that we are.
No, it doesn't. And I think that's why we need to look at health completely differently, starting with ourselves, the patient, what we put in our mouth, the questions we ask ourselves, how we see ourselves. A simple question I ask my patients too is this action loving to you? And people start crying. It's like, what do you mean I could change how I see the world, how I interpret things, have an audit on their thoughts? And and actually completely reframe their pain, because all that part is up to us. And the problem, the way the medical system is set up now, in like 5 to 7 minutes, you can't have that dialogue.
Right,
And,
right.
And so we can't get there.
The doctor's in a hurry to get on to the next patient. Look, I know you'll be tonight taking as much time as people want at the Barnes & Noble. And you'll be at the Mira Mesa Market Center on Westview Parkway
at 1
tonight.
o'clock.
At 1 o'clock this afternoon.
Right.
So, folks, you don't have to wait that long. You can get up there at 1 o'clock this afternoon. Yep. Barnes & Noble, Mira Mesa Market Center, Dr. Manon Bolliger. Great to see you. It's what patients don't say if doctors don't ask. So take an active role in your own health care. Great to see you.
Thank you.